Headache after COVID vaccination. After the COVID vaccination, you may experience flu-like side effects, including headaches. However, these complaints can also be an indication of rare cerebral vein thromboses that are associated with the AstraZeneca vaccination. Find out how you can recognize a thrombosis and what helps against the headache. More and more people are being vaccinated against the coronavirus. Local pain at the injection site and flu-like side effects often occur after the vaccination. These include chills and fever, fatigue, joint pain and headache. These reactions usually occur within 2 days of the vaccination and rarely last longer than a day or two, says the Paul Ehrlich Institute, which is responsible for the safety of vaccines and drugs in Germany. The vaccine reactions are not a cause for concern, but a sign that your immune system is dealing with the corona vaccine and making antibodies. With the approved vaccines, most reactions are seen more often in younger people than in older people. With mRNA vaccines such as BioNTech, Pfizer and Moderna, the vaccination reactions are more pronounced with the second vaccination than with the first. With AstraZeneca's vector vaccine, it's the other way around. The side effects are more pronounced with the first dose than the second. Headache is one of the most common side effects after vaccination, and in the vast majority of cases is nothing to worry about. However, many people are unsettled, as there have been some rare cases of cerebral vein thrombosis after the AstraZeneca vaccination. A sign of this rare sinus vein thrombosis is a headache. Compared to conventional headaches, these are particularly severe and long-lasting. They appear 2 to 3 weeks after vaccination and last for several days. They cannot be relieved with common pain relievers. Other signs that it is a cerebral vein thrombosis are bruises or small, punctiform hemorrhages in the skin, especially on the arms and legs. Neurological symptoms such as hemiplegia and/or sensory disorders, speech disorders or epileptic seizures are also indications of a cerebral vein thrombosis. If you get these signs, see a doctor straight away. If left untreated, cerebral vein thrombosis can lead to death. The European Medicines Agency, EMA, is currently reviewing the mRNA vaccines from BioNTech and Moderna with regard to a possible risk of blood clots. So far, no connection between vaccinations with both vaccines and the occurrence of the rare side effect has been discovered, the EMA told the AFP news agency. After a few cases of rare sinus vein thrombosis after vaccination with AstraZeneca, there was a vaccination freeze for several days. The AstraZeneca vaccine was then recommended only for people aged 60 to 69 years. In May, the federal and state governments approved the AstraZeneca vaccine for everyone nationwide. According to the Robert Koch Institute in Germany, you can take medication such as aspirin, ibuprofen or paracetamol against the vaccine reactions and thus against the headache. Experts advise waiting about 6 hours after vaccination before taking the medication, as it can affect the effectiveness of the vaccine and impair the formation of antibodies. Therefore, if you want to relieve your symptoms naturally, we recommend the following home remedies. Number 1. A lack of water can make headaches even worse. Therefore, drink at least 2 liters of water so that the blood becomes thinner and the oxygen supply improves. Number 2. Put a cool washcloth on your forehead. Number 3. Peppermint oil is known for its pain-relieving effects. The contained menthol has an anesthetic effect and influences the messenger substance serotonin. Number 4. Gently massage your temples. Place your fingers on the areas that hurt and apply light pressure. Massage the bridge of your nose between your eyes as well. This has a relaxing and pain-relieving effect. Number 5. A walk in the fresh air is good for you and stimulates the metabolic processes and blood circulation due to the increased oxygen supply. Number 6 and finally, allow yourself some rest. Excessive media consumption such as smartphone, television or PC strain your eyes and can make headaches worse.